So this is looking at the positivity rate all the way from May 1st to December 24th. And what the positivity rate really is a measure of, let's say every 100 people we test, how many of them are actually going to be positive. Now, the WHO basically gives us a safe zone, which is 5%. So if we test 100 people and we find 5 of them or less having coronavirus, then we know we have a low enough level of circulation in our society that we can consider doing certain things. I like to think of that doing certain things as a risk budget, where your testing, your tracing efforts, the amount of virus you have in circulation, all those things allow you to estimate the effectiveness of your public health response. Now, what you spend that risk budget on is things like opening schools or opening entertainment centers or opening markets, the things that are essential to life and the things that are necessary for comfort. Those are things to spend the risk budget on. But if you look at where Ghana has been all the way from May 1st to December 24th, there have been very few times we've actually, whether for hospital testing or contact tracing, been in that safe zone where we could have been doing the things we said are safe to do. If we think back to June 15, for example, where the Ghana Health Service and Ghana Education Service decided that they were going to reopen schools for final year students, also around the time where the voter registration actually began, what you see in the positivity rate is a rise from somewhere around 7 or 8% in late June. That then continues to as high as 30% in August. When we hit 30% positivity rate in our hospital testing in August, that would have put us where places like Bergamo in Italy, where at the start of the pandemic in March and April, which saw calamitous results for their healthcare system, it actually put us throughout the month of August in the top 15 countries in the world for positivity rates. That makes a lot of sense when you put it together with what WACPIP found, because what that number suggests is that really all the way from June to August, we had explosive, uncontrolled community spread. And we even saw that translate into infections at the seat of government, into the deaths of prominent political leaders. And then you have a period right after that where you see that sudden decline. That sudden decline corresponds with the change in the testing definitions. It corresponds with the changes in pricing and costing of the tests, where a different kind of person starts to test. And that kind of person who starts to test is the kind of person who's about to travel, people who generally had not had the same kind of average risk as the rest of the population. Because even the WACPIP study, what they found was that for people who fit proxies of high income, the percentage of them who actually were infected was much lower, it's about 15%. Whereas for people who fit the lower or middle income categories using the proxy they had in the study, the infection rates were actually about 22 to 27%, depending on which. So that sudden decline you see in the positivity rate reflects that shift towards a different kind of person. And that kind of continued for a while until, people started, arriving in the country again. We began to increase community-based testing again. And that's when we started seeing, the bit of an uptick in positivity rates again, right from late November through December. But again, what is obvious from the graph we have on the screen is that if 5% is supposed to be safety, then there really hasn't been a period really since early May where we've been consistently under that zone. And if you compare that to how the narrative of what's happening in Ghana is, it seems a little bit discordant, because what we've been hearing is, Ghana is on top of it, we are managing the pandemic, but the practical questions of even what the Ghana Health Service is putting out in terms of its own data suggest that when we were opening schools, when we were doing voter registration, when we're saying that it was safe to begin the easing, throughout that period, we're higher than we should have been in positivity rates, and we're still that the decisions we made then resulted in a steady increase until we're in the top 15 in the world. And what the WACPIP study shows is the consequences of those decisions. And so the question we have now in Ghana as a function of our testing and our tracing and everything is really about what is the state of the pandemic. And Where we are really is in a place where we don't know. That's the truth, because we're not testing enough to have any representative data on positivity rates. We don't know the level of community transmission. We are not testing. There's too many financial barriers in terms of also individual, self-demand testing that are also causing quite a few challenges. And then there's also the requirements by Ghana Health Service on public institutions to meet certain criteria before they can do any other kind of free testing that comes with diagnostics.